In our first community conversation, we're joined by Dr. Rebecca Dillingham, an infectious disease specialist with Sentara Jefferson Hospital. She's sitting down with Kate.
Thank you, Steve and Becca. Thank you so much for joining us today.
Thanks for having me, Kate.
All right, so as an infectious disease specialist, just tell me a little bit about what hepatitis C is and why it is a public health priority for you guys.
Absolutely. So hepatitis C is a virus that attacks the liver. In fact, it's the most common cause of viral hepatitis or inflammation of the liver in the United States. It's a public health priority because it's so common. Between 2 and 4 million people in the United States have hepatitis C, and here in Virginia, about 36,000 people have hepatitis C. And that can be particularly tricky in the case of hepatitis C because a lot of times people don't know that they have hepatitis C. It can be asymptomatic. And so despite the fact that people may not know they have hepatitis C, it can lead to really severe consequences like cirrhosis, which is severe damage of the liver, or liver cancer. On top of that, even if you don't get severe liver problems from hepatitis C, you can have things like terrible fatigue and other symptoms that really affect quality of life.
Right, and kind of on that note, we know that Virginia has rolled out a plan to address hepatitis C and kind of the treatment for it. Yeah. Tell me a little bit about that plan, what you know about it, and why that's so important.
Absolutely. So I am really excited that Virginia is one of only 13 states to have developed a hepatitis C elimination plan. And so I'm really excited that the state will be working with community partners, with practitioners, with public health experts to prevent and also to cure hepatitis C, because now we are able to cure it and we could actually get rid of it, which would be great.
Okay, so you're mentioning now that it is actually curable too, and I think that might surprise a lot of people. So just tell me a little bit more about that.
Absolutely. Thanks for the opportunity to say something about that, because it is curable and many people do not know that. Until about 2014, the treatment for hepatitis C was really hard. It involved shots. It was associated with a lot of bad side effects, and now it's only medication by mouth. So it is pills. You do have to swallow pills every day, but only for about 2 or 3 months. And the medication works over 95% of the time. So, and it's a cure. You are done with it. So we are really excited that that treatment is available now.
It's really good to know. And so let's say someone tests positive for hepatitis C. Maybe they live in a rural area, maybe they don't have the best access to health care. What would you recommend to them as the best way to access treatment?
That's a great question, and I want to underline that everyone should be tested for hepatitis C. The CDC recommends that everyone be tested for hepatitis C at least once. And if you are interested in hepatitis C treatment, first of all, always a good idea to go to your doctor, nurse practitioner, physician's assistant. But as you mentioned, some people don't have good access. In that case, I would recommend visiting virginiahepc.com, because there is a place there where you can refer yourself for treatment, and that is from anywhere in the state, and we will get back with you and let you know what's available in your community or make sure you have access through telehealth.
Okay, you know, I think that information is going to help just so many people. So thank you so much for being here today. That's all the time we have, but we appreciate this information. So
thank you very much.